Hi, everyone. Thanks for joining today's webinar. My name is Adam, Content Marketing Specialist with Schein, and I'll be your moderator. If you have questions, please type them into the Q&A section of your control panel, and we'll cover as many as we can at the end of the webinar. Please make sure that your volume is up and any large applications are closed on your computer or mobile device to ensure a smooth connection. This webinar is presented by Schein Dental, and no CE credits are being offered for viewing this presentation. I'm pleased to be joined today by Ali Oromchian, one of the nation's leading legal authorities on topics relevant to dentists, and Dr. Jonathan Levine, a renowned dentist and prosthodontist in practice for nearly 30 years. Thank you both for being with us today. Take it away.
Thank you. Thank you. Welcome, everyone. So I'm excited to be doing this with all of you and Dr. Levine with you as well. So I guess I'll get us started. We are definitely in a very kind of interesting time in our country. I think that goes without saying, but we have seen a lot of things kind of reoccur that we thought maybe we had some control over. So what we're going to talk about today is really how to handle a lot of these difficult conversations that are coming up. So we're not going to talk about, the PPP loans. We're not going to talk about really the CARES Act. We're really going to just talk about the most common questions that we're getting right now, having to do with employees and the team coming back and how to navigate that. And the reality is that we know that our success or, God forbid, our failures are intimately tied with our employees. They are absolutely tied with our team, and the stress and the things that a lot of them are feeling and going through are not unlike the things that you're going through. But of course, when you're a business owner, you have to deal with it on a whole different level. And we're going to go through a lot of things together today because there's some things that have definitely changed. There's some things that are the same, but we may have forgotten because COVID has kind of, made it very difficult to remember things. And we're going to talk about how to handle these very difficult conversations because these are the conversations we are seeing more and more. And unfortunately, something that we thought we had control over when a lot of offices around the country opened up again has clearly made itself visible again, and if we don't have it under control, and many states are seeing very significant spikes in COVID-19, which is impacting the team. Now, the good news is that based on what the WHO and the ADA and others are saying, there isn't any transmission that they know of COVID-19 within the dental practice, and that's a wonderful thing. What is, however, occurring is the fact that employees are going out and spending time with their families over the weekends and going to the beach and going to the mountains and getting their hairs done and nails done and getting a haircut and going to the barbershop, whatever, coming back and bringing it sometimes into the office. And so we've got to be able to handle and talk and manage that because that is becoming a very real thing inside the dental practice. And so that's what we're going to spend most of our time on. I am a dental attorney. This is all I do every day. And so, feel free to ask questions at the end if you'd like, but, we focus on practice transitions and leases and partnerships and of course, employment law and things of this nature. So this is something that we're going to go into really great depth. My wife is a pediatric dentist, and I show this picture of my family for that reason, to tell you that, this is my life. I've done what you have done, and I'm in your shoes in many ways, because not only am I obviously a dental lawyer, but more importantly, I'm married to a dentist, and so I go through everything that you're going through. So I've been in the peaks and valleys of what's going on with COVID from a dental practice owner's mindset. And so the things that we're going to talk about today are things that you're going to be able to use almost immediately in practice because I know they're the things you're going to face. So we're going to talk about our current state. We're going to talk about the current HR laws. We're going to get to common questions. It's a really good format because these are the most common questions we're getting nationwide. So hundreds of times every single day, our entire HR team, our law firm team, our lawyers and whatnot, and the state associations are getting these questions. And so I'm going to go through them with you. And then finally, I'm going to give you some resources at the end for you to use. All right. So let's get started with the initial item, which is hiring and rehiring. Now, most of you have brought back your team members by now. You've opened up your doors. Some of you hopefully have brought back all of your teams, but most of you have brought back probably a large majority, but not everyone, for a variety of reasons. You know, some people might be fearful, some people might have contracted COVID and are still testing positive. We'll talk about all of those in a second. But what's important to remember right now is that as you're getting started and you've hired them back on and you're hopefully a month or two in to practicing, what we know is that the patients are not the issue anymore. I think there was a real fear that patients would come back or not come back. And I think for most around the country, patients have come back in droves. There are some subset of those patients that aren't coming back yet fully, and those are the elderly or immunocompromised, but for the obvious reasons, I think that makes sense. But for the most part, I think most patients are coming back to the office, and so revenues are good in that sense. What is, however, occurring is that the employees are not necessarily coming back. And initially, when things opened up, it was really more a PPE issue, right? You didn't have enough PPEs. There were serious distribution channel issues going on with, China and things being shipped, and the hospitals here in the United States taking a large majority of the PPEs because of the anticipated spikes that were occurring. And so there were serious distribution channels. Thankfully, now with the leadership of Henry Schein, what we in the state associations, what we've been able to see is that really these distribution channels have opened up and relaxed significantly. And so now, for the most part, you can get your hands on some good PPEs. Of course, you always have to be careful of the fake stuff out there, but if you go through, the right channels, you will be able to get what you need. But what hasn't changed now is still the employee side of things. And so this is the biggest part that we are right now. One of the biggest things that we're seeing is making sure that you're bringing the team back well. And what do I mean by that? Well, in most states around the country, you need somewhere between 12 to 18 documents per employee when you have them working for you. That's 12 to 18 documents that are required in each state on average. And so you want to really make sure you have those. If you go back into your employee files and you don't have those 12 to 18, and by the way, those are minimums, right? There's minimums. There's a lot more that you need than that. But if those are minimums, if you don't have that, then make sure you contact HR for Health so that we can get those to you ASAP. It's really important that you get those in place, especially now. The reason is because if somebody gets sick, if somebody needs to file for workers' comp, if there's an emergency in the office, you've got to be able to rely on the documentation that is required. And so make sure you have that. Make sure you get an updated employment manual as well. Hugely important. By the way, you don't have to pay an attorney like me thousands and thousands of dollars to draft one for you. I mean, that's ridiculous. We all know that you might do that once, but you're not going to do it every year. So, HR for Health will give you one for free as part of their membership. And every year it's updated. So there's no excuse for you not to have it. And make sure that you get one that's 2020, post-COVID or during COVID specific, because there's a lot of new disclosures regarding harassment and unlawful termination and various other things in terms of discrimination that need to be inserted in there. So make sure you have all of those things ready to go. All right. Now, one of the things we get a lot is, what if my employees are sick and they're scared to come back to work? Or maybe they're not even sick and they're just scared to come back to work. How do I manage that? And so here's what our recommendations are right now. And you got to handle this very carefully. But basically, what we're recommending is that you discuss the employees' fears and how the practice is specifically trying to allay those fears and keep the employees safe. What do I mean by that? Well, you want to talk about a couple things, right? You want to talk about the proper PPEs that you have. You want to talk about the social distancing. You want to talk about the screening that you're doing of the patients and of the team. You want to talk about all the enhanced infection control practices that you're putting in place. Many of you have gone above and beyond what you have to do in getting equipment and technology and other things to protect the team. Make sure you tell them that. Make sure you talk about it. They may not notice all the things that you're doing. This is an important aspect of it, because in our experience, if you're having these conversations with the team, you're much more likely to maintain them and to allay their fear so that they come back to work. A lot of times, this fear that they have is not rooted in anything other than just not knowing kind of what's going on with the practice and what's going on with COVID. They don't have access to the information you have access through webinars like this. And so the more you can educate them, the better. Now, let's just say you've done that. Let's say you've done that, you've tried and you've had these conversations and the employee still refuses to come back to work. At that point, if those discussions have been exhausted, okay, and there's no other health concerns, right? There's no other risk factors. The patient, the employee, I should say, is not immunocompromised. They're not giving you a doctor's note. They haven't been tested, they're not tested positive for COVID, or they're not hanging out with somebody who has COVID. Then in those situations, you might be able to terminate them, or they might be voluntarily resigning if they're not coming to work. And so those are very important discussions to have. So I will give you my information at the end. Make sure you follow up with me if you're ever going to let somebody go, so that I can walk you through it with no strings attached, because it is a very risky thing. Okay, so just kind of keep that in mind. The other thing is sometimes employees don't know that they're going to lose unemployment if they're offered a job and they don't take it, and so that could be something to bring up as well. Something that we see frequently these days is working interviews. I know there's some mixed feelings about working interviews, but we have seen that it works really well to when you're looking to hire somebody. My recommendations is make sure that the working interviews, you do a couple of things in advance, right? So first is you want to make sure you get in writing with the employee about how much you're going to pay them, per hour for that working interview. Give them the hours, say, okay, I'd like you to come from 10 to 2. Like you to come from 9 to 3, whatever it is. Make sure you're very clear about that. And then how much you're going to pay them for the time that they're there, so that there's no confusion. At that point in time, if once they leave and you've paid them, if you decide to hire them back on or whatnot, then you'll need to make sure at that point you've got all the W-4s and the I-9s on file. Technically, you're supposed to have those even for the working interview, but I know most of you won't do that. But it is important to get those in place, if you decide to offer them the position. And remember, there's offer letters, there's all the new hire paperwork that you need as well. Okay. Now, a frequently asked question is, can I withdraw a job offer for someone who is either tested positive for COVID-19 or has symptoms of COVID-19? And currently, based on the CDC guidelines, the answer is yes, because if the employee cannot safely return to work, then you can withdraw the job offer. Now, I want to be clear about this. This and a couple of other things we're going to talk about in a second are COVID specific. So if somebody gets pregnant, you can't withdraw a job offer, okay? If somebody, suddenly tells you they have asthma or something else, you can't withdraw a job offer. But for COVID specifically, you can. And if you don't want to withdraw it, but you do want to delay it, you can also do that. And you can say to them, look, I don't want to withdraw the job offer, but I will delay it a couple of weeks. Go get tested again after the 14 days. Make sure you're tested negative, and then come talk to me, and we'll talk about it. And so make sure that this is in your job offer letter that you give them. Again, if you need job offer samples, the ones that are compliant, let us know at HR for Health. We'll make sure you get it. Okay, we'll make sure you get it. So again, really important stuff. All right, what if my employees are high risk and they're exposed to COVID-19 in some way? This is happening all around the country, absolutely all around the country. So what does it mean to be high risk right now? Well, obviously, if you're 65 and over, if you're pregnant, if you have diabetes, asthma, or immunocompromised in any other sort of way, then that is considered a high-risk employee. Now, the Department of Labor, because they're so worried about people discriminating against other employees, have made it clear that you cannot delay the start date of someone who you believe is a high-risk person. So if someone's older or they're immunocompromised and you're like, well, I don't know if you should come. I'm in downtown New York City. I'm in California. I'm in Miami, wherever. And there's a lot of risk here. The Department of Labor says you, as the employer, cannot do that. Right? The employee is the one that has to request the delay of the start time. So just make sure of that. I know it's coming from a good place. I know you're trying to protect your team members. It's not coming from a negative place, because I've talked to so many of you nationwide. It's always coming from a good place. But just remember, you cannot be the one who brings that up. It has to be their idea. It has to be coming from them, okay? So hugely, hugely important, okay? Now, another thing that we get is, what if childcare, right? What if there is childcare, but the employee doesn't want to give up their child to this one childcare agency, or they're kind of, you know, not really seriously looking for childcare, and as a result of that, they're not coming back. At what point is that enough? Well, there's a couple of situations you have. I mean, in some states, there are websites that have been created by the state that provide childcare options to its population, and the idea there is that, you know, as long as there's a childcare, you know, near their home or the office, that's sufficient. It doesn't have to be like the ideal one or the one that they want. But if someone can't come in because of childcare, then the FFCRA and the 2 weeks that is, you know, potentially available to them, you know, in terms of being paid, and then after that, it could potentially not be paid. But it's a very fact-specific situation. So just remember, it doesn't have to be the employee's typical childcare provider or even their first choice. It has to be a childcare. And in that situation, if they still can't find something, then the FFCRA may be applicable. But make sure you contact someone like us so that we can just kind of walk you through it a little bit. All right. Now, one of the things I'm getting is, can I restrict travel? New York City, New York State, I should say, some other states have done the same thing. Can I, as the employer, restrict my employees' travel to other, you know, states, countries, or high-risk activities? Okay, and the answer to that is, you know, technically yes. You know, well, let me rephrase that. You can't prevent them from doing anything lawful, right? So you can't say to them, hey, I'm denying, you can't travel, you know, to Mexico or to New York or to whatever. But you can deny vacation requests. You can ask questions about where they go. You can do those things that would make it difficult for the employee to potentially go. And so that's an important thing to keep in mind. You can also ask them to quarantine if they've done something that you consider high risk due to the fact that, you know, it falls into the guidelines. Then you can absolutely quarantine them and ask them to quarantine for 2 weeks. Now, what's important to remember is you got to do this evenly across the board. That means that if you're going to have a travel policy where you say, look, if you're going to leave the state, then you're going to have to quarantine, then you got to do that across the board with everybody. If you're going to say, look, if you're going to go to the beach or this or that, and I find out about it, or, you know, then you're going to have to, you know, get COVID tested, or you're going to have to quarantine, then again, you're going to have to do this liberally with everyone. So just kind of keep that in mind, because it is very, very difficult to set a policy like this and stick to it if you make it too narrow. So make sure it's reasonable, and make sure it's something you want to do, right? Make sure it's something you want to do. Now, what we do know is that the CDC has said that if somebody does travel internationally, and a lot of, you know, Americans right now are traveling to Mexico, they're traveling to the Caribbean, you know, they're traveling to, you know, other sort of vacation hotspots that are still, you know, within easy travel distances here. You can, you know, again, require them to quarantine for 14 days. What a lot of people don't realize is that when they get to their stated country, they may even have to quarantine there as well. So again, you know, very difficult to, you know, to sort of manage that. But that is something that is available to you. What I would caution you, and something that I would recommend, is make sure you have open line of communication with your team, because if you make this too narrow, if you make this too difficult for them, they will try, you know, they will be less than honest with you. And if that's the case, it doesn't really serve your purposes. And I think the goal is for this to protect everybody. Now, what do I do if one of my employees tests positive for COVID? What do I do then? And this, by the way, is something, again, happening all the time. The primary thing is that you want to make sure that you have really good communication with your team. Now, here's the other aspect of it. If someone tests positive, you got to make a couple of determinations, which is, were they in a high risk scenario, or were they in a low risk scenario? So how is that defined? If someone is not wearing masks, they don't have their PPEs, and they're communicating with somebody for 15 minutes or more, and they're within a 6 feet of distance, that's considered high risk. And at that point, you got to notify the other folks and make sure that they're quarantining or looking, for their for symptoms. If someone is under gown, right, in a typical dental practice, if they're wearing their entire PPEs, they may be within 6 feet of distance, but they're protected and they're not spending more than 15 minutes of time, and then they're considered low risk, and you just have to monitor for symptoms. You don't need to have to quarantine, which is very important. Where does this become a problem? The place this becomes a problem is at lunchtime. So what we are seeing is that at lunchtime, the team, your team, takes off their gowns, takes off their masks, they sit around a table and they have lunch together. Totally normal, obviously, but not during these times, right? Why? Because if they're sitting around the table together, they're typically going to be within 6 feet, and they're typically taking off their masks, and they're spending more than 15 minutes. In that scenario, right, if that is happening, and then one of those employees has tested positive for COVID or they've been exposed to it, then potentially you would have to quarantine all of them for 14 days, or have them go get tested as a result. And so it does get tricky. It does get very, very tricky. There are a lot of ways around that. Eating outside. If you have a place you can eat outside. Keeping physical distances, eating at their desks, not working, of course, but, eating at their desks and things of that nature. You just got to be creative. But this is where we're seeing a lot of problems, right? We're seeing a lot of problems as a result of this. And remember, if one person gets it and they're part of that group that I just described, it could potentially then be an issue for the rest of the team, which means that the office may have to close down if everyone's being quarantined. All right, now we've got an exciting interactive quiz for you. If you are in that situation, we've got some valuable resources as well for you. So if you text the word Schein20 to that phone number, which is the 44222 phone number, you'll get something back from us. And if you give us your email address, you'll get something in your email immediately. It'll be a link to our resources. It'll be this quiz that we've got that walks you through what I just described if somebody tests positive. It's a lot of great material, lot of new stuff coming out on it that we're publishing all the time because of what's happening, Q&As and documents. So make sure there's no strings attached. You don't have to be an HR for Health customer, to get access to this stuff. But if you are, you get access to some more things. But yeah, feel free to get that. Here's my email and phone number if any of you have any questions. I know we are getting a lot of questions about the HHS loans and the grant that's coming down the pipe there. They have extended the deadline to August 3rd, which is good, but there are a lot of things in the fine print that you have to be careful about. And so until we get the new FAQs from the government on this HHS loan, just be careful, as there are some traps that you just have to be aware of. So I try to stay true to my 25 minutes. I hope that's okay. Dr. Levine, I'm going to hand this back to you.
Okay. Ali, that was so great. I got to be honest with you. I just made a note to myself, hire Ali immediately.
Anytime. You can call me anytime.
No, but I mean, just the truth of the matter is that, we need to be surrounded by experts, and things come up, especially in this, upside down world of COVID-19 that we're all facing. And, we don't have big companies that have HR departments, and we really need to be able to outsource the experts. So I thought that was really fantastic.
Thank you. I appreciate that.
Happy to share this with you. So thank you, Henry Schein. What I'd like to talk about today, I'm a entrepreneurial dentist for the last 25, 30 years, started a number of companies, been a professor. I am a professor, associate professor at NYU, running the advanced aesthetics program for a number of years. And as a clinician, you put all these things together. You say you learn a thing or two along the way. And I've always had a certain mindset of things that I'd like to share with everyone. And it's 45 days since we opened in early June. And so what I'd like to do is really try to dig in on a mindset that we need to adopt, I think, when we're facing issues and problems, to go through a little bit in the next 25 minutes of the facts that we need to know to deal with the fear that's out there, both from our patient standpoint and also on our people. And really, numero uno is our people. And so we'll go through that, and then some of the learnings that that we have learned over the last 45 days, and to share with you a 7-point plan that we put together as a team prior to opening, and that's what we worked on kind of over March and April and May before we opened, that I want to share with everyone. So the title, I call it, is Survival or Reinvention, and I really say it is kind of our choice. This is my team. We're pre-COVID, we're about 26 people. We have 5 technicians, both analog and digital designers. I'm prosthodontist. We have a number of specialists. And my core team, we've been together for over 20 years, and a number of young people also. I always talk about my Brazilians. We have 15 Brazilians out of 25, and how that happened is too long a story, but very blessed with passionate, hardworking people. So we have a choice of survival versus reinvention. And what I really mean by that is when we faced with a problem, and there's, you know, just going back over the last 10 years, 20 years of issues that we faced, whether it was a financial crisis or whether it was 9/11 or whether it was personal crisis, it's an opportunity where we can actually take a step back and adopt a creative mindset and say, how do we solve for this? Versus, you know, just merely surviving, but actually, how do we become better because of the challenge and the changes that we can put into our business, whatever business it is. We happen to be into the business of dentistry. We happen to be into the business of taking care of people. Personally, I love that. I love our profession. And I want to share with you kind of the things that I like to think about. So if somebody says, hey, we're in a dark tunnel, is there a light shining at the other end? And I would say definitely there is. But we have to think about it in terms of not how do we do what we are doing, but how will we do what we are doing in this very different world, because we're faced with a COVID-19 world. Much like, let's just say we're in the coffee business and all of a sudden an amazing chain like Starbucks opens up on the corner. What are the changes that you're going to make to really reinvent your business? Or when some other company comes on board and challenges what you do, do you sit there and say to yourself, oh my God, the sky is falling? Or do we think about bringing our people together, adopt this creative mindset, develop strategies that allow us to actually catapult ourselves beyond where we ever thought we could be? So that's the kind of thinking that I like to think about. The opportunity is, what will we be when we come out of this? How are we going to reinvent ourselves? And I can tell you that the things that I'm talking about, and 45 days later, the social distancing, all of the appointments from the treatment room, and getting people's credit cards, and not working a front desk, and not having a waiting room, and all of these things that we've put in place because of COVID-19 is making us better. And those are some of the small things that we're going to talk about. We are not going to allow COVID-19 to put us out of business. You know, quite the contrary. We're going to reinvent ourselves as a new company, and that's what I want us to think about. But first, before I jump into that, I want to talk about some vision here. And the vision, when we're dealing with a challenge, is to set that vision. And then you say to yourselves, what happened if I achieve that vision? So the vision is reinvent our practice to create this safe haven for both our patients and our team. That's kind of the vision, almost the hypothesis that I want to pose for us going back and reopening our dental practices. The result of achieving our vision is that the fears that everybody is living with, I'm going to catch COVID-19, I'm going to get sick, I'm going to bring it home to my parents, I'm going to, you know, all of that, it's going to be replaced with a very positive mindset of optimism and growth. That's the result. So if we have two objectives as a business and a dental practice in caring for our patients, it is to protect both our relationships and the sustainability of our business, which is a positive cash flow. The obstacles that we face, of course, is the fearful staff, our team, our patients, misinformation, not truly understanding the facts, additional unknown expenses, and all these things that we can conjure up that we really have to jump over these obstacles. Once we go past these obstacles, we can then build the strategies, these strategies necessary to now reinvent the business. Once you develop these strategies, the action plans fall from that. So I always like to say, and I've always said through the teams that I've kind of learned this, it's not the problems we face, but it's how we face our problems. And when we think about a company, whether it's an insurance company or a restaurant or an online business, we need people. And the people are the most important things we have. Because if we develop a team and a collaborative approach, we can do things. It's impossible to do things alone. And when you develop a team, you have to develop trust. Numero uno is the most important thing we can develop, because we say the company is culture. And if we develop and spend time, and if people had spent time before COVID-19 and hit this challenge, and all of a sudden this challenge hit, whatever challenge it is, well, it's a lot easier to solve it because you can work together. You're used to working collaboratively, and there's the speed of trust, as Covey would say. So culture is created by your people. And then these conversations that you're able to have with your people, which is to go through these obstacles and develop new strategies, will happen because you've spent the time up front developing these core values and this great culture. So companies that create this positive culture in the times of a crisis can creatively solve. But flip the coin and think about, what is it like to have a culture that you didn't spend that time, you didn't realize you needed to spend that time, and it's never too late. So what you're looking at is a lack of willingness to get out of the comfort zone, because that's what we need. So when you do have a team culture, you have that willingness, you have that eagerness to be part of the solution. You have the ability to create and learn new protocols and work together. You can empower your patients. When you flip it in the lack of team culture, what are we dealing with? We're dealing with reactive mindsets, upset, finger pointing. We're dealing about the blame game, uncooperative, lack of trust. All of this comes together. And this is the negativity side of the coin. And this needs to be flipped to more of the optimistic, positive side of creative mindset. So knowledge is power. And what we need to start with, and what I want to go into over the next 5 minutes, is really a fact base, that what we know from a scientific standpoint. So when this thing hit, I'm very blessed to be part of this European group. It's Federico Brunner and Christian Coachman and Bruno Pereira and these wonderful professionals that all get together on WhatsApp. And remember that Spain and Italy, of course, China, they were all ahead of us. So we were getting some scientific articles and some very good evidence ahead of what we knew was what happened. Unfortunately, I don't want to get into our lack of federal mandate, but the truth of the matter is that we had 30, 45, 60 days to really develop great learnings. So listening to my colleagues, I really started to have an understanding of some of the facts, especially around aerosol generating procedures, because there's a lot of misunderstanding there. And I'm going to dive right into that. I'm going to try to separate some fact from fiction. We all know this dashboard, and we're over 140,000 deaths. Things are flipping in the rest of the country, in California, Texas, and Florida, where cases are going way up, and we understand what's happening when you're not social distancing, not wearing masks. This thing isn't going away anytime soon. So let's look at the fact. The name of the virus is SARS-CoV-2. A lot of people call COVID-19 the virus. The name of the virus is SARS-CoV-2. We all know that, right? COVID-19 is the disease. How does this thing get transmitted? It's transmitted typically through respiratory droplets. You cough, and the heavy respiratory droplets fall to the surface, loaded with virus. We're going to talk about viral load. What's floating in the air are aerosols, very micron-sized particles, not heavily loaded. We're going to talk about this. What happens when it hits the surface, you touch the surface, you touch your face, you're not wearing a mask, 20 times an hour we touch our face, we get transmission. And we now understand that that's the major mode of transmission. So let's dive into some of the terms. Infectious dose is the amount of virus needed to establish this virus, this disease. The infectious dose of COVID-19 is not really known, but suspected to be very low. The viral load is the amount of virus found in a test sample. Okay, so you have an infectious dose, the amount of virus you need to get sick, and you have how much load is in that saliva or through a cough, which is coming from the nose and the back of the throat and the saliva. For us in dentistry, the big question and the big confusion is around these aerosol generating procedures, AGPs, or if you want to call them AGDPs, aerosol generating dental procedures, or AGMPs, aerosol generating medical procedures, because that's where the confusion is. They're very different. They don't have high-speed evacuation in the emergency rooms. And when they're intubating a patient, they're forcing the patient to cough right into, unfortunately, the face of these frontline workers. Very, very different than AGPs, that is from an aerosol handpiece. We're going to dive into this. So do aerosols caused by dental interventions, is the big question, contain an infectious dose of SARS-CoV-2? A fantastic article by Mayer and Korn, 2 orthodontists. I have it on my website, and I'll tell everybody my website, jblnyc.com. But it's a great article. It's really a position paper, and they did a great job looking through the references. We have other articles, and I've done a bunch of blogs on this, but it answers the question, do aerosols contained by these dental aerosol generating procedures cause an infectious dose? In other words, will our people get sick? Or, of course, the people in the chair, but will our team get sick? So it came out very early from Wuhan School of Stomatology. 1,926 people were working. Only 9 got infected. They were wearing not even PPE, but the basic level 3 masks, an incredibly low infection rate of 0.47%. So this really started, this came out very, very early on. The date on this was around end of Jan. This was Meng. Let me keep going. So the controversy of aerosol and aerosol generating procedures, let me just X this out so I can see this better. The dental community have expressed concern that AGDPs could facilitate the infection transmission, okay, endanger the staff. That's the big question. I point you to at the bottom of this slide, Mayer and Korn, 2 orthodontists at Toronto, wrote a terrific position paper that I'm happy to share with people. It's on my website. Well, we have 50 years of study for AGDPs. We learned so much, from the AIDS crisis. We've been dealing with dental aerosols for 50 years, and we're really good at barrier control. So, and we know that high volume evacuation, which we have in the dental office, reduces by 90%. And then we'll talk about what happens when you add a rubber dam on that, and what happens when you add PPE on that, higher level N95 type masks. Very low chance at all. So studies on HIV and AIDS, all of the studies have the same phrase. To our knowledge, there is no evidence that general dental aerosol exposure has resulted in any infection of dental healthcare workers. Bam, or patients, provided that you have PPE, HVE protocols, and of course, our normal barrier control. So my statement that I want to make, and I want to prove it with science coming up, we can conclude that while general dental aerosols may be unpleasant to consider and to look at, they have not been shown to transmit disease. Well, coming out of China from Peng, they realized that mouth rinses and 1.4% or 1% hydrogen peroxide will do a very good job at killing the SARS-CoV-2 virus, and that rubber dam adds another high percentage of protection on top of the HVE. Okay, so this is also from Peng. We understand the transmission. We have an infected patient, the droplets, it goes either in the air, the very small viral load, or it goes onto a surface. But for us, for dental professionals, it's all about the aerosols. So let's think about this. This was a great study. This was done by Maraska. And with normal breathing, the number of droplets are very few. Nasal expiration or laughing, very few. When you start coughing, it starts moving into the hundreds of how much virus is the number of droplets generated, indoors. A single cough, a single sneeze, now you're dealing with hundreds of thousands and millions. So a single sneeze can generate over 1,000 droplets. Okay, let's think about that. So let's compare the two. Now remember, an aerosol, if somebody coughs, is these small particles, let's define it, that hang out up in the air. They're so small, they hang up in the air for a period of time. The heavier particulate matter will now land onto the surfaces. They drop, right? They drop down because of gravity. Aerosols are liquids or solid particles suspended. Droplets are bigger, not suspended in the air. They are not the same thing. This is classic from my friends in Madrid, Federico Bruno, 2020, amazing oral surgeon in Madrid. And I want to thank him because he really showed me this and taught all of us as he did the research first. It's not the same. A sneeze versus an aerosol is not the same. Let's dive in on that a little bit more. In an aerosol, they're very small. This is just an animation, a picture. In a droplets, they're loaded with the virus. So aerosol versus droplets that are on surface is very different. Big viral load in droplets, very little in aerosols. So when we start and when we have, let's just say, these aerosols, but these particulate matter that's in the saliva, we're working with water handpiece spray. And after a few minutes, whatever the viral load is, it's getting incredibly diluted. It's diluted by the water. So in summary, the evidence to date points to the fact that droplet transmissions as the primary vector is SARS-CoV-2, that dental aerosols have little to no history of infectivity. When you're wearing PPE and you've got high volume evacuation is being practiced. This is our level 1. This is basic. This is what CDC is telling us. This is what ADA is telling us. 6 months of patient data have clearly established that COVID-19 is spread primarily by this surface contact, this droplet transmission that loads up to surfaces. The probability of infection from viral exposure is proportional to both the viral load and the time, the amount of time. And the lowest rate of viral shedding occurs during nasal breathing. We know that from Maraska studies. And during dental procedures, patients' viral shedding is very low as related to HEMPs. Remember, the medical aerosol generating procedures, like intubation of a patient, is completely different from what we do in the dental office. Dose and time are mitigated during the dental visits due to what we wear, our PPE, our HVE. And of course, we are all practicing social distancing in our dental practices. We have decades, 50 years of precedent fact. Dental professionals have routinely generated aerosols in patients, and you go back to all the different viruses, nobody's ever gotten sick. HV and routine, or very few, of course. HV and routine PPE has protected our staff. And the recent closure of our dental offices, remember this, was not about dental aerosols, but it was all about social distancing. Social distancing is part of the governor's mandates. Our medical and dental aerosols, as stated, are not the same. Real danger really is our front desk, because if people are touching surfaces and sneezing, and that's why we're eliminating the waiting room and we're cleaning the surface areas, and our front desk people, our operational team, they need to be wearing the mask for sure and hand sanitizing. Unfounded emphasis on dental aerosols have created a false impression that visits to the dentist are dangerous. The fact is that patients are unquestionably safer in our dental offices than in most other social settings, and our dental team is safe as long as we're practicing proper protocols. Here's a fact that I got by the end of May, early June, from a dear friend of mine who has one of the biggest DSOs. They had 1,200 offices, 700 were open, 60,000 appointments. Over the course of April and May, when everybody was just doing emergencies, they had 60,000 emergency appointments. Not one dental team member was infected, not one. So the lesson, and with all this data, is level 1 protection can be sufficient. So I break it down into 3 levels. We have a level 1, which is our ADA recommendations, which we're taught what we're talking about, which is PPE and high volume evacuation. Then we can have level 2 that I'd like to refer to as air quality improvement. And level 3, I want to bring that to the forefront as this is coming right around the corner, being pilot testing, the ability for our dental practices to be testing our patients and then also be testing our team on a bi-weekly basis. I'll talk more about that. Our ADA, we know all about their protocols and what they did during this crisis. I thought the ADA, working with private companies like a Henry Schein, did an amazing job at really getting us the important facts. So, we all know about how to handle this level 1. The fact of the matter is that coronavirus won't be the only communicable disease that we're going to face, that the changes that we're putting in place in our dental practices are not going away, and then we're probably looking at the new norm. The interim treatment that ADA came out of, that actually came out of China from Peng's work, is that hydrogen peroxide as a pre-appointment rinse or brush will kill the virus, and you have to reduce any viral load coming in from the portal of entry, being the eyes, the nose, or the mouth. So we have this as a standard for hydrogen peroxide rinsing. Here's the different hydrogen peroxide. I've started a company called Glow Science. We have a product called Eco that I just want to show you. It's a more favorable experience for the patient. So instead of hydrogen peroxide, it's 1.4% hydrogen peroxide. We're actually working closely with Henry Schein and the other distributors on this. It's a post-foaming gel. So as you warm it in this mouthpiece, we use the mouthpiece for 2 minutes before the appointment. And I'll show you a little bit what that looks like. The technology basically allows us to use this hydrogen peroxide and sodium bicarb, kills the viruses, does a great job, and the gel becomes a foam, and it really goes all over the inside of the mouth. Most of the viruses kind of set up in the saliva from the studies under the tongue towards the front of the mouth. So this does a great job. And we have our patients brush with this Eco, which is a gel. We put it on top of the toothpaste because it has a huge anti-inflammatory effect for the pathogens and the bacteria that cause chronic inflammatory disease, periodontal disease, and gingivitis. So you could ask the reps about Eco, and this Journal of Perio just got published for Eco, which was a very good antibacterial. So level 1, basic PPE. We all know this. We go through the questions. We can gown our patients. We put a mask. We put hand sanitizer on. We do all of the things that we can do to protect ourselves and to protect our patients. We now know a lot about N95s. We never knew what it was in November. I didn't even know what an N95 was. But now we know that we have these level 3 masks that we've been wearing. That's very good with air filtration. But what these N95s allow us to do is really to seal off the mask so that we can't get any viral particles from the side or from the top. So that has become the standard of care. If we look at a level 2, we can think about air quality. I'm just going to show you some of the things that I've done and I'm thinking about, and you're going to have to do your own research. But the idea is to take the next level, a little bit of an extra protection when we think about air purification or extraoral suction or ionizing sodium chloride or this hypochlorous acid. There's a number of air filtration units that some are designed extremely well. Some uses HEPA filters, some use a technology called PICA, some are really great at carbon filtration. Also, another great company, Surgically Clean Air, something that I have in my office now because we have closed rooms and we have these air conditioning, heating units, so in the handlers, this is a company called Clean Air EXP, very impressed with it. Laser sensors tell you what the particulate matter is, and they're ionizing the air as it goes through the air handler. The big question everybody says is, do we need these extraoral dental suction system? It isn't going to hurt. I personally have not used them. I think it's something that we could look at as of course, as the next level. This I do have, which is ionizing sodium chloride. This has very good research. This hypochlorous acid. We put it into spray bottles. This unit's all of about $240 after the patients. 2-3 times a day, we're spraying it into the air. Level 3 is viral and antibody testing. I'm going to bring this as fast as I can to leave some time at the end for questions. But this is very interesting because Henry Schein is very involved with this, the ability to test our patients and our team. The differences between COVID-19 testing, both viral up front from saliva testing or antibody on the back end. 2 terms we need to get good at, understanding is sensitivity, a true positive test, and specificity, a true negative rate. So these tests that are going to come out, we need to ask the questions, what is the sensitivity like? What's the specificity like? There's a number of tests, but what we're talking about is that 3 days before a patient comes in, we'll be able to send them a saliva test. This saliva test, they spit into the tube, they send it to the lab, the results come back the day before they walk in the door. This is anybody who says yes to any of those 5 important questions of traveling and been exposed. We also can now test our team a couple times a month to make sure that nobody on our team is carrying the virus, and we can test them. So we came up with the team, and we have assistant team, hygiene teams, operational team, a 7-point plan. And with the plan, what we talked about is 7 points: over communication messaging for our patients. So during COVID, we were emailing, and we were talking to our patients as much as possible. Spoke to the team on a weekly basis and individual teams, assistants, hygienists, and our ops team every week. We created social distancing protocols. I know we're all involved with this, social distancing scheduling, where we stretched out the day so everybody's not on top of each other. New safety protocols for the patient, infection control protocols for the treatment room, which we have had amazingly well, but now we leveled up with it, and barrier control. The messaging for our patients, we put a video together. I want to show it to everybody now.
We want to welcome our patients back to our practice. It's been a long road to get here, but together we will get back to a healthy place. We've chosen to reinvent our practice so that we can follow all the important protocols as set forth by the American Dental Association, and in fact, go above and beyond these guidelines to create the safest haven possible for our team and for you, our amazing patients. We've been practicing infection control in dentistry for 30 years, since the AIDS crisis. And now we are going to reinvent infection control to the next level. At JBL New York City, health and safety is the highest priority. We have reorganized our front desk and waiting room, and you will no longer see a waiting room that is used for that purpose. But in fact, you will be escorted directly to the treatment room when you come to the office. Our personal goal is to make our practice at 923 Fifth to be a safe haven, the safest place possible for our patients and our team. And as the stay-at-home order is lifted, it is essential to get back to health, and oral health is a great starting point. With our new protocols and training with our team and elevated PPE and technology, along with social distancing scheduling, your safety and health is our #1 priority. We look forward to inviting you back into our practice, to seeing your smiling face again, and together we will win this war against COVID-19.
So that's what we came up with. And I can't tell you how many patients just said, wow, that was so great, and it was positive, and it was uplifting. And we put that together with our team. And it was basically that encompasses our 7-point plan, and the over-communication to our patients went a long way. So I want to just go quickly through the June learnings, the last 45 days. And what I realized was that people want a new normal. People are desiring health and coming back to the dental practice. And as we said, oral health is a great starting point, is a good idea. What this COVID-19 did is exposed areas of weakness. And what I mean by that is these 3 months was the ability to really deep dive into our practices, how we're doing things, and where are the efficiencies, and how do we make some changes. So that's opportunity. I think needs to be a big focus on culture from before. And if you didn't have it before, need to have it now. Solvency is the ability to have a sustainable business. So there's this wonderful opportunity to improve our practices. And what amazingly happened is I realized everybody wanted to come back. We're just about at full hygiene. I had to bring my 4 hygienists back. I saw an increase of wear, a lot of inflamed tissue. People haven't had cleanings for months. And we really tried to reinvent what we're doing to fall in the guidelines of social distancing, but also to improve ourselves. And what I realized that I think dentistry has gained even greater importance in the minds of our patients because they really appreciate what we do. So I believe that our 7-point plan is working. When do we get to our new normal? I think when we have accurate fast testing, which is really around the corner, antivirals that's just about here, and a vaccine hopefully does appear by December, January, I think things are going to start calming down. I share with you something that's been important for me as I think about building culture, is to develop commitment from our team, to develop these new capabilities. We call this the 4 C's. Commitment develops courage. Courage develops our capabilities, these new skill sets that we have to develop, like when facing a COVID-19 challenge. And then this builds the confidence for our team growth and our own personal growth.
Let's make believe a stranger is on an elevator with you and asks, what do you do for a living? It's up to you to know how to respond. You may say, I'm a dentist, or you may say, I transform people's lives by bringing their most beautiful smile to life. Together, we will help inspire our profession to meet the needs of the 21st century, challenge the status quo, to drive disruption and reinvention.
And I share that with you. That was I was honored to speak at the commencement for Boston University Goldman School of Dentistry. But reinvention is the opportunity that we have here, and to really look at this as this wonderful challenge to make ourselves better, our team better, and to really meet the needs for our patients. There's my email if anybody needs to get in touch with me. This is the book that we published for aesthetic dentistry. These are the worlds that I live in, be it the practice, the companies, and the universities that I'm involved with. And thank you very much. I'm going to stop here and stop sharing, and then hopefully we have a little bit of time for some questions.
Awesome, thank you. We do have a couple questions. One for you, Dr. Levine. The question is, we have plenty of N95s and KN95s available, but one of our doctors refuses to wear either during procedures. They only wear level 3 and no face shield during surgical procedures. Their reply is, I cannot work with those masks. It makes me nauseous and unable to work. I will wear the surgical masks at my own risk. As a manager, how do you suggest I handle this?
You know, that's a good one. You know, first of all, if that surgeon was tested and we made sure that he was safe, the ability for him to transmit was down to 0. He's correct in stating, if we make that assumption, he's correct in stating that this is at my own risk. I would suggest to him there are some shields that are coming out that the big problem is with these level 3 masks is that you have openings on the side. So there's 2 things he could wear. He could wear these new shields that are getting developed. The problem is that all of our PPE and all of our shields are developed for medical and developed for emergency rooms. And so what's happening is companies now starting to design for us. We have to go over loops, we have headlights, we have all these things that a lot of the normal personnel of an emergency room doesn't have. So that's gonna get better. And he is doing it at his own risk. There is also a frame that can be made around the level 3s that actually hold it tight to the face. And that's interesting. And I do believe the future N95s will be more comfortable, and there are companies that are going to figure that out and redesign them. So he is at his own risk. And as a manager, I would just make sure that the guy doesn't have any viral load, any viral shedding, you know, not positive for SARS-CoV-2, and he's at his own risk.
Awesome. And then Ali, I know you got quite a few questions from your segment. Was there any one in particular that stood out to you that you want to answer for the group, or just a recap?
You know, I think one thing that I saw was somebody asked, you know, can I get sued if someone in my office gets COVID-19? I think there's a real fear of that. And what I would tell you there is, you know, if an employee gets COVID-19 in the office, which again, you know, as Dr. Levine said, it's you know, nearly impossible if you've got the right PPEs. Workers' comp will cover you. The only time workers' comp will not cover it is if you don't have the proper PPEs. Now, I know it sounds crazy, but there are some areas of the country where PPEs are not used, you know, as much as I think, you know, a majority of the country is using it. And so there is that risk, but you know, that's the only time workers' comp will deny. If a patient gets it from the office, then your general liability insurance will cover it. But as Dr. Levine mentioned so astutely, and I think it's very important to remember, is that, you know, having it occur in a dental practice is very, very difficult for that to even occur. But to prove that it happened in a dental practice, considering all of these other things, is even harder. And so, you know, it's impossible to know where someone gets it. But your general liability, your workers' comp is there to protect you. So.
Great. Well, look at that. 1 hour right on time. So with that, I want to thank you both for the very insightful presentation. And of course, thank everyone for attending tonight's webinar. If you have additional questions pertaining to the topic that our speakers covered, please email us at webinars@henryschein.com. Or if you got their email addresses, feel free to email them directly. As a thank you for attending, we will be sending out a link of today's recording in the coming week via email. On behalf of Henry Schein, I'd like to once again thank Ali and Dr. Levine for their time today, and I hope everyone has a great night.